So, good evening, everyone, and welcome to today's webinar on what's new in flu, current challenges, and management options. For this webinar, today we have with us our guest speakers, and I would like to take a moment to introduce them. Today we have with us Dr. Ankit Kumar. Dr. Ankit Kumar is Assistant Professor in Department of Respiratory Medicine, King George Medical University, Lucknow. Dr. Ankit Kumar is specialized in chest medicine and he has over 10 years of clinical experience and vast experience of treating COVID-19 patients. Dr. Ankit Kumar specialized as an asthma and chronic obstructive pulmonary disease specialist, pulmonologist, diabetologist, critical care medicine, and he is a member of Indian Society of Critical Care Medicine and American College of Physicians. Along with Dr. Ankit Kumar, today we have with us Dr. Kapil Rathi. Dr. Kapil Rathi is specialized in internal medicine, chest medicine, diabetology, cardiology, and critical care medicine. He has vast 14 years of clinical experience and treating almost 1200 plus COVID-19 patients. Besides completing his graduation and post-graduation in medicine, he underwent the specialized training in diabetology, cardiology, and critical care from various reputed national and international institutes. He is an active member of Kurla Suburban Doctor Association and Andheri Parle Physician Association and various other medical bodies present in India and abroad. He has also been a co-investigator for various clinical trials and surveys conducted by Indian and multinational companies. So with this introduction, we will start with today's webinar. I request Rathi sir to take ahead from here.
Okay, thank you Manohar, thank you Hetero for this kind invitation, and hello everyone who are there, who are joining with us or probably have joined. So it is my pleasure to be here and to discuss something about the topic which is quite relevant in this current scenario. So Manohar, you can just play the slide for me.
Yeah.
Thank you. And I also welcome Dr. Ankit and thank you for coming and being part of this discussion. Probably this will go long for understanding of the disease as well as for making a lot of awareness about the illness which is currently there, and a lot of misconception probably which we will try to rectify today. So that is how we plan out. So and I hope and wish there will be a good discussion at the end of the talk so that we are all very clear about what we are going to. So this is the topic. What is the challenges and what are the management options which are there? So what is new in flu? Flu is nothing new. It is almost a century-old disease probably, but yes, it keeps on changing. That is what is new. And it always bamboos us, it always buffle up. That is something which is new, and probably we take it more lightly and then we end up in the problem. That is where we are going to consider about the current managements and what is going on around the world. Next slide. So we will discuss about this will be the content of my talk today, which will be current challenges in understanding flu. That is very important to understand the basics of flu, and then probably the complications, what happens with flu, and then we have something which offer to our patient like drug like Oseltamivir, and we'll have some evidences for that, how strong we are on evidence-based medicine for this drug, and last but not the least, what are the guidelines which are recommended for the empirical use of Oseltamivir, which is actually the need of the hour. So this is how we are going to pan out in say next 30 or 40 minutes. Next slide. So if you see, the flu is making news around around India and probably around the world also. It's just like COVID, what was there in 21, 22 probably, or so there was havoc, and probably because that was a new disease, so we were more concerned about that because we were not knowing about the outcomes, the disease complications, and everything was so new. So we were very very touchy, very very emotional, very passionate about COVID, but we are not that much about flu because we know a lot about flu, and probably that is where we are keeping our guard low for the flu, and that is where we are actually making a mistake. That is what I feel. So but now this is making headline across the country, and in a paper like Times of India you can see that there is a high fever causes and other causes. So there is a lot of noise around this so-called H3N2 or a variety of flu, and obviously all these cases, we all know the cases always goes up during the seasonal flu and everything, but this is something which has happened in last couple of months or probably 3 months, is that the cases have been they are going quite high, and probably linked to basically the mutation of the virus and probably the environmental factors, and probably a lot of lack of awareness. That is what I feel. Everything has been labeled as COVID. So probably we are missing a trick here, that we are missing a lot of cases of flu which which are quite treatable as compared to COVID. So now there is a private hospitals which has always started a screening all in the metro city and probably all other big cities of India, so that at least we can have a good data, or at least we can triage our patient very well, whether these are flu patient or whether they are COVID patient. Next slide. So this is how the buzz is going around the flu. So that is very important. But to make things more worse, or to have it knowledge that flu is not seasonal but it's a perennial condition. It is across 12 months across the year you can see flu cases, and probably in Mumbai where I come from, probably it is always been 12 months. You always find this kind of patient which are there, and we probably end up having a lot of diagnosis, a lot of preemptive around the just like what happens during the peak season, and this might be across the country also. So there is a surge in prolonged illness, flu-like illness in children. There is a surge in high grade fever which are there in children, and probably H3N2 is the cause which is linked to the rise in high fever and disease. So this was proven by an ICMR data which says almost 92% will have fever, 86% will have cough, and remaining will have some breathlessness or pneumonia. Now these are very common symptoms which are always there with lot of upper respiratory infection, lot of viral infection, lot of bacterial infection. But yes, flu remains the foremost and the front runner in all these causes. Now viral infection is in full swing, we all know. Now H3N2 infection is in the air. So the current flavor of the season is basically an H3N2 variety of the flu, which is very important. And mostly the pediatric population less than age of 12 or 15, these are most the vulnerable section which is there, and they are getting a lot of pediatric colleagues must have getting a lot of patient about this. So it is not only in pediatric but also in adult patient also. Probably Dr. Ankit will also agree with me that they are seeing a lot of this viral viral kind of, or so-called viral like flu illnesses which are there, which are not proven unless we tend to go for investigation, but these are very common. And this rising pollution and temperature fluctuation lead to significant infections like flu. We all know, probably we are seeing a lot of the wind and rain which are happening during this even summer season also. Yesterday, only day before yesterday, there was heavy rains in Mumbai. So this seasonal variation is the basically the recipe for increasing the number of the flu cases. So that is very important. Next slide. So these all environmental factors are going to make you more worse scenario. Now there is a huge surge in flu cases, and the symptoms are very common, very typical. Probably every second patient will come with same symptoms, and you end of the day you are so confused that whether it is COVID, flu, or any adenovirus, rhinovirus, whatever you call it, and everything will be same because they are all upper respiratory infections. They probably have got the same runny nose, fever with cough, body ache, sore throat, vomiting, diarrhea, lethargy, arthralgia, feeling low, a lot of weaknesses. These are all common symptoms with all viral illnesses to start with. So this is the same thing with flu. Next slide. Now influenza data from ICMR network of laboratory, which they say that the ILI or influenza like illness and severe ARDS or severe acute respiratory illness SARI for detection of human influenza virus and SARS-CoV-2 is ongoing through structured surveillance at 28 cities. So there have been a lot of surveillance which is going on, whether it is whether it is ILI or whether it is SARI. That is very important. The problem is that during the period of first 9 weeks of 2023, that means we are talking about first 3 months, the surveillance network has monitored the human influenza virus and SARS-CoV-2 infection in SARI and ILI cases. You can see the result across the 9, and if you see the middle chart or the influenza A H3N2 chart is on rise. So you can see that flu is on the rise from the starting of this year till the date we are talking. So influenza A, that too typical H3N2 variety. This is not my own data, this is ICMR data. So we have to believe the sample size was from across the country, across the major cities, and across the good reputed laboratories. So you have to believe that influenza A is on the rise for last 3 or 4 months, and probably that is what we also seeing in our practice. Next slide. So healthcare related challenges are very important, like influenza like illnesses which is across it is so common, so rampant. H3N2, which is again the sub variety of influenza like illness only, and there are severe acute respiratory illnesses because there are a lot of other viruses also there, and still COVID is there. We all know in last 3-4 days we are seeing almost 2000 plus cases every day. The clock is going up and up. It is more ticking. So we have got more than 30,000 active cases of COVID as of now. But believe me, in that headlines of COVID, there is a lot of influenza which has been hiding. So you have to find out that influenza or flu-like illness, or influenza-like illnesses, which is the cause for a lot of upper respiratory infection, and the causative organism being H3N2, which is quite treatable. Next slide. So dynamics of occurrence of illness in influenza in relation to seasonal variation in Chennai. There was a 7-year cumulative study. This is, this has all been published, and this is almost 3-4 year old data, which has done, and basically what they have collected more than 36,000 samples from infected or from so-called suspected influenza, and the study was duration for 7 years. Now influenza positivity started with the onset of monsoon and peaked during the post-monsoon period. So that was the typical. That is where we also tend to give a lot of vaccines before your monsoon starts. But the problem is that now this issue is not being only seasonal, but it is being annual. So it is being throughout the year. You can see all these peaks going on up and down. Now currently we are in our so-called peak summer season now in India, but still we are getting so many flu cases and so many other viral influenza like illnesses because of the same thing, because of the climate change, and possibly because of the change in the composition of virus. That is what is happening. But yes, monsoon and the rainy season is the start where you can get all your flu cases to come up, and possibly it will go till December, January, what we have seen in our day-to-day practice. Next slide. So overview of influenza in India. If you see causes of influenza infection, and death because of that, if you see the green one, which is 2019, and blue one being 2015, the cases has gone up. You can see it has started from 4,000 in 2015 and gone to more than 28,000 in 2019. And what I have heard today last was it has been, the proven cases has been crossed to more than 3.5 lakhs in India. So for this 2023, that was the latest data. So and obviously when there are more cases, you will get more severe cases and death occurring because of this illness, and that's why the death has gone from, say, triple figure from 300 to 4 figures, like more than 1,200 cases in 2019. So the problem is here, or the signal is here, is that the influenza is increasing, and so are the influenza related death which are increasing. That is where your bells start ringing, that you have to do something to prevent this, and that is something which is preventable. This is not like COVID, which is a newer illness to us. This is probably the illness which has been, we have dealt for so many years, and possibly we can win over this illness if we treat them properly and we treat them aggressively. Next slide. So influenza is one of the most common infections caused by influenza virus. We all know it is highly contagious. That is where the problem is, and it basically goes in season epidemics, but it can go around the year, and it can causes acute febrile illness, and it can cause mild to severe. So it can there like a simple sore throat or
Uh, I think Ankit sir.
Dr. Rathi, yes,
Yeah.
please continue. I think Dr. Rathi's server is down.
Acha, I'll just inform sir. Yeah.
sorry, I think we just missed it. Okay, no problem.
Hello.
Yeah. Can you hear me now?
Sir, I can hear you. Sir, you
Okay.
can start. Yeah.
Sorry. So next slide, please. So what I was talking about, how severe can be, the flu. Now, to understand, one need to understand the, the varieties of influenza viruses. That is very important, and I think that is the basic what we need to understand, because that is where the treatment lies. That is where the confusion always been there, whether it is treatable, non-treatable. So to make it very simple, influenza viruses are basically of, there are 4 types, to be honest: A, B, C, D. COD का कोई काम नहीं है, because C जो है that only happens in basically very mild disease. अगर हुआ भी तो it is very simple upper respiratory which doesn't require anything, and D happens only in mammals, so it happens only in animal. So what we are worried or what we are concerned is basically 2 प्रकार के हैं, जो influenza A and B. Now influenza A is most important because that is the most commonest form of flu, and it causes epidemic because of this antigenic variation, and it can causes periodic pandemics. That is what is happening currently because of the antigenic variation. So this drift lift and shift pattern which occurs with flu generally causes you either a endemic or sometimes pandemic. So H3N1 was pandemic. Now typically H3N2, what happening is India is currently very epidemic in India. Possibly it will go through the world also. Now influenza B, it infects human but causes very local epidemic. So it does not that fatal as compared to A. Now A is the problem where everything happens. So all your changing, your antigenic shift and drift happens mostly in A. B, you can have disease but very milder variety. C, basically it causes very mild infection, so practically no need to worry, and no test for C also. And D only happens in mammals, so don't worry out. So this is how your influenza A, B, C, D is there. So next slide. So once you understand the type of virus, then you should understand how it transmits, because it can transmit just like because it's an upper respiratory tract infection, it can spread through your cough, nasal droplets, and other the fomites and everything. So it can just go like COVID, 6 feet and everything. So the people important is that because patients are asymptomatic most of the time, they doesn't exhibit any symptoms, and they keep on coughing, they keep on speaking, and that is how you can get disease very fast, and that is how it spreads in family, in the house, in the community. So that is very important. So again, same thing, if the patients are sick, you need to make them little isolated, ask them to wear mask, and sometimes you have to wash your hands and other thing. What we are following all these protocols for COVID, same protocols applies for flu also. But again, the most important thing is that a healthy adult may be able to infect other people beginning from day one of symptoms, and can develop up to 5 to 7 days and becoming sick. So possibly the incubation period is quite long in this flu also, and that time he can be very contagious and can spread illness to multiple people who are affected है. So आपको एक बात ख्याल रखनी है कि जब भी आपको फ्लू होता है या किसी में सस्पेक्ट होता है, तो उस आदमी को या उस व्यक्ति को आपको अलग रखना है, सो दैट इट डजेंट स्प्रेड वेरी फास्ट, बिकॉज इसका भी जो आर नॉट वैल्यू है और इसका जो कॉन्टेजियसनेस है दैट इज़ वेरी हाई. सो दैट इज़ वेयर द प्रॉब्लम इज. एंड चिल्ड्रन में, बच्चों में, दे कैन पास वायरस फॉर लॉन्गर देन 7 days. अगर घर में कोई बीमार है और उसके घर में अगर किसी को 5-7 दिन बाद में भी कोई इलनेस होता है, तो पॉसिबली शायद उस बच्चे की वजह से आपको वो वायरस मिला हो सकता है. सो ये चीज़ आपको ख्याल रखना है कि चिल्ड्रन कैन पास दिस वायरस लॉन्गर देन 7 days. नेक्स्ट स्लाइड. So, symptomatic differentiation of ILI, H3N2, SARI, and COVID-19. I think this is most important slide which can actually make you a little more aware about कि हम इन चारों बीमारियों में से कैसे पता करें कि ये बीमारी शायद ये हो सकती है, unless and until you give it a sample for diagnosis. So it is not possible sometime to give sample for diagnosis, because lot of people, lot of doctor who must be listening, they must be practicing in little small areas or small cities where it is very difficult to get samples, and you can't run PCR on every sample. That is very difficult. So if you understand ILI, they will have all symptoms like fever, myalgia, cough, lack of energy, sore throat. So these 4-5 symptoms are common with everything, चाहे वो इन्फ्लुएंजा लाइक इलनेस हो, चाहे वो H1N1 हो, चाहे वो H3N2 हो, चाहे वो सारी हो, चाहे वो COVID-19 हो. These are the very common symptoms because these are viral symptoms. These are all constitutional symptoms. Breathlessness is something which in influenza like illness it may be there, it may not be there. But in H3N2 it can be there most of the time. In SARI obviously it will be there, and obviously in moderate to severe COVID it will be there. But loss of taste and smell जो typically COVID का feature था, that too in the first phase, not for Delta but the first phase, that was very common with COVID, which is not the case for other influenza like illness. ये एक बात आपको ख्याल रखनी है. Diarrhea, which was very common with COVID-19, we have seen so many patients, it is not that common with ILI, H3N2 or a SARI. Headache and basically high grade, the high grade fever, headache and lack of energy or so-called lethargicness is very common with H3N2 or basically an H3N2 or influenza like illness, but very common with. So what cases what we are seeing right now, they are coming with very high grade fever for 1 or 2 days, they are coming with severe headache, body ache, and they are coming with lot of lack of energy, drainage. डॉक्टर साहब एकदम उठने का मन नहीं कर रहा है, ऐसा लगता कि बस सोते रहे और बस पड़े रहे. So this is the very typical symptom which is patients are coming with. So that is what is trend, what we are saying. So possibly this is something to do with H3N2. It can be there with ILI or SARI sometimes, but it was not there with COVID-19 that much. The fever was not very high grade. It was like 9900, but in these cases we are seeing fever like 102, 103. So this is very common with severe acute upper respiratory infection like H3N2. Next slide. So these are subtle differences between all these four, which are the commonest variety. But the emergency warning signs of flu sickness in children can be all this. What we know that, shortness of breath, fast breathing, a lot of bluish skin discoloration, not able to drink, severe vomiting, severe diarrhea, being very irritable, and cough and fever not coming down. So these are in children, these are the all red flags. And in adult, if you see, again same thing, but more to do with difficulty in breathing. There will be sudden dizziness, sudden weakness. So sometimes there is a persistent vomiting which happens, and sometimes patient will have fever which will come, go, again come back and again go. So this waxing and waning of fever, it is also a very typical sign of flu-like illness. In addition to this, patient get medical help right away from any infant, because these are little different category of patient. So for that you have to be, if the patient is so sick that he cannot eat, he's very difficult in breathing, or he has got no tears, absolutely dehydrated, so this kind of patient you require an immediate hospital admission and further treatment. So these are certain signs which you need to see in some patient so that you can differentiate between a milder disease to a severe disease. Next slide. So complications of flu, it can be many things, like from bronchitis, ear infection, ARDS, pneumonia, death, everything. So it can hurt from your upper respiratory till your alveolus, and therefore you can have fatal outcome like death also. So that is very important. Next slide. That's why we need to treat it fast. Now, how do you manage influenza? Next slide. So to manage influenza is largely supportive. We all know it's a viral illness. Most of the time it is self-limited in most of the cases, but you require good bed rest, you require good fluid consumption, so you have good rehydration, you require symptomatic management like probably an antipyretic, cough suppressants, and basically sometime NSAID for patients who are not responding to your normal treatment. But most of your patient will recover in 3 days. However, malaise may persist for a week. That is very typical. Even in COVID also we have seen that post-COVID weakness was there for at least 3 to 6 months. So same in flu also, you can see a weakness. Your disease may be cured, but your weakness and your lethargy might take almost 2 to 3 weeks to get recovered. So that is very important. So you have to have a supportive measures in this kind of patient. Next slide. So this is how. Now if you see, why we are all discussing, because there is something which is very peculiar to the disease, is the antiviral drug which are available. Now we have got two drugs which are available. One is a neuraminidase inhibitor and one is basically an M2 ion channel blocker. So neuraminidase inhibitor is example is Zanamivir and Oseltamivir, and M2 ion channel blockers are adamantine, or basically the drugs are rimantadine, amantadine. Now the both are available with us, so that is good news. Now the first we talk about basically is adamantine or M2 ion channel blocker like amantadine and rimantadine. They interfere with hydrogen ion channel activity of the influenza A virus, thus blocking it entry into host cell. So क्या करता है, एक चैनल होता है, हाइड्रोजन आयन चैनल होता है वायरस के ऊपर में, जिसके वजह से वो आपके बॉडी के अंदर में आपके एपिथेलियम में या रेस्पिरेटरी म्यूकोसा पे जाके बैठ सकता है. सो अमेंटाडिन क्या करता है, उस चैनल को जाके ब्लॉक करता है, एंड दैट इज वेयर इट विल वर्क. सो दैट इज वेरी इंपॉर्टेंट. But then I'll tell you how it is weaker as compared to neuraminidase inhibitor. But now the most important drug is neuraminidase inhibitor, which blocks the viral neuraminidase enzyme, which is critical in releasing virion from the infected host cell. So अगर आपको infection हो गया आपके respiratory epithelium में जाके, then virus can multiply itself in the respiratory epithelium in the form of virions. और जब वो virus विरियंस में चेंज होते हैं और आपके बॉडी के एपिथेलियल सेल पे या रेस्पिरेटरी एपिथेलियम में बैठते हैं, और बाद में वो बस्ट होके सारे वायरस को अंदर रिलीज करते हैं, देयर हाउ यू गेट इलनेस. उस बस्टिंग को, उस विरियन को रोकने का काम जो है वो न्यूरामिनिडेज inhibitor करता है. That is what is the oseltamivir is. So what does oseltamivir does? It prevents, or basically it blocks that enzyme which is important for the release of virion. So उस virion को वहीं रखता है, उसको बॉडी में खोलने नहीं देता है. That is the action of oseltamivir. That is very important, and that is where you will have this drug which works very well. So the good part is that neuraminidase inhibitor is active against both A and B. So that is very important. But unfortunately, amantadine and rimantadine are only active against influenza A virus. So that is the caveat. So that is the only difference between these two. दोनों का अलग अलग मोड ऑफ एक्शन है, बट पोटेंट ड्रग ज़्यादा न्यूरामिनिडेज इनहिबिटर है लाइक ओसेल्टामिविर. amantadine इज लिटिल वीकर ड्रग. amantadine इन्फ्लुएंजा बी में काम नहीं करता है, बट न्यूरा और ओसेल्टामिविर ए और बी दोनों में काम करता है. सो इफ यू गिव ओसेल्टामिविर, probably you are covering almost all the influenza viruses. But if you give only amantadine, then you have to prove that it is only influenza A virus. So that is the caveat, or that is the शॉर्ट कमिंग और ड्रॉबैक ऑफ M2 आयन चैनल ब्लॉकर। हमारे पास में 2 ड्रग है न्यूरोमेडिस इनहिबिटर में, ओसेल्टामावीर एंड ज़ैनामावीर। ज़ैनामावीर नेबुलाइजेशन फॉर्म में आता है, ओसेल्टामावीर ओरल फॉर्म में आता है, टैबलेट फॉर्म में भी है, सिरप फॉर्म में भी है। वेल एमेटाडीन एंड रिमेटाडीन आर इन ओरल फॉर्म ओनली। नेक्स्ट स्लाइड। So antiviral therapy with oseltamivir. So our drug for today is oseltamivir. It is a potent and selective inhibitor of neuraminidase enzyme of the influenza of A and B, both influenza viruses. It's a pro drug. That means जब आप गोली खाते हो तो ये pro drug होता है, एक्टिव नहीं होता है. Once it goes into your body, it becomes activated. So oseltamivir carboxylate is the active drug which the activity happens in liver, और वहाँ से वो पूरे शरीर में जाके आपके जहाँ जहाँ पर वायरस है वहाँ जाके उसको अटैक करेगा. It inhibits influenza replication, that is what I told you, and also the release of the influenza virus, that is pathogenicity. It prevents further spread of infection, तो जहाँ infection आपका है वहीं रह जाएगा. And it is effective against all strains of influenza, whether it is A or B, and it is effective against all the variety, all the cross variety of influenza A, like H1N1, H3N1, H3N2, H5N1, and so on and so forth. So the good part is that it will act on neuraminidase enzyme which is present in all kind of influenza A viruses. और आप कॉम्बिनेशन भले कुछ भी ले लो, लेकिन आपका न्यूरामिनिडेज रहेगा उस कॉम्बिनेशन पे, और ये ड्रग जाके उसी न्यूरामिनिडेज पे जाके इनिबिट करता है. देयरफॉर इट कैन एक्ट अगेंस्ट एनी पॉसिबल कॉम्बिनेशन ऑफ H3N1 और H और N का जो भी कॉम्बिनेशन रहेगा. सो दैट इज द ट्रिक. सो वन नीड टू अंडरस्टैंड, आप सब लोगों को ये पता रहना चाहिए कि इस वजह से ये ड्रग कोई भी इन्फ्लुएंजा वायरस का अगर क्रॉस वैरायटी भी आता है तो उसमें ये काम करेगा. दैट इज वेरी इंपॉर्टेंट. दैट इज वाई इट इज इफेक्टिव इन H3N2 ऑल्सो, विच इज द करंट वायरसेस इन द country. Next slide. So oseltamivir is the drug. Now if you see this slide, ये थोड़ा सा कॉम्प्लिकेट साइड है, फार्माकोलॉजी की जो स्लाइड है, पर आपको अगर आप सिंपल देखोगे आप इसको, तो यू कैन सी दैट तो जो विरियन होता है इसके अंदर में, यहाँ पे उसके ऊपर में आप देखेंगे कि ये जो हीम एग्लूटिनेशन और न्यूरामिनिडेज जो है, अभी आप देखोगे जो ऑरेंज कलर के जो दिख रहे हैं आपको स्पाइक वो न्यूरामिनिडेज है, और जो आपको नीले रंग के दिख रहे हैं वो हीम एग्लूटिन है. तो ये ऐसा स्पाइक होते हैं, जैसे साइकिल को स्पाइक होते हैं ना अंदर में जो व्हील पे रहते हैं, वो टाइप के स्पाइक होते हैं. तो उसके अंदर में जो ऑरेंज वाला जो न्यूरामिनिडेज है उस पे जाके ये ड्रग बैठ जाता है और उसको वहाँ से वो एंजाइम को ब्लॉक कर देता है, सो दैट वायरस डजंट गेट कन्वर्टेड इनटू विरियॉन्स एंड दैट नॉट फर्दर रिलीज. तो दैट इज हाउ दिस ड्रग विल वर्क. सो अगर आप देखोगे ये ऊपर में और नीचे में, यू कैन सी दिस वेरी वेल इन दिस कार्टून. बट एक सिंपल लैंग्वेज में, ज़्यादा कॉम्प्लिकेशन ना करते हुए आपको इतना ही बता दें कि न्यूरामिनिडेज इनहिबिटर, न्यूरामिनिडेज जो साइट होती है वो एंजाइम होता है, उसको जाके ब्लॉक करता है. सिंपल. नेक्स्ट स्लाइड. So oseltamivir was first oral neuraminidase inhibitor, yes, and it is approved in more than 100 countries, possibly more than that now, and it is the drug of choice for your viral influenza-like illness. Next slide. And it is approved by all the societies across the world. Now the doses, सबसे important. Now if you see anyone who's adult, or adult means basically more than 40 or 45 kilos, जिसका भी वजन होता है, you have to give it for 5 days. The dose is simple. It comes in a capsule form, so you can give 75 milligram का capsule का strength आता है, so you have to give it 75 milligram twice daily for 5 days. Maximum you can give up to 10 days. ठीक है. Now this is for the treatment part. Now if you want to give a chemoprophylaxis, अगर हम किसी को देना चाहते हैं इस संभावना में कि शायद उसको हो या शायद पता नहीं, लेकिन उसको हम देना चाहते हैं बेनिफिट ऑफ डाउट, तो यू हैव टू गिव अ prophylaxis in the form of 75 milligram once a day. So that is very important. अब चिल्ड्रन के अंदर में it has to be given according to the weight, and what we have got is basically this all 4 categories. सो अगर लेस देन 15 किलो है, सो 60 मिलीग्राम पर डे रहेगा. सो यू हैव टू गिव इट इन 2 इक्वली डिवाइडेड डोजेस. सो वो आपको सिरप में भी मिल सकता है. तो सिरप के अंदर में आप देखोगे तो दैट इज़ वेरी इंपॉर्टेंट कि सिरप इज़ 12 मिलीग्राम पर ml. सो अगर आपको 30 ml आपको अगर देना है वन से डेली, तो व्हाट यू हैव टू गिव इज बेसिकली 2.5 ml. सो 2.5 ml सुबह, 2.5 ml शाम में. अगर आपका वजन 15 किलो से कम है, तो 15 से 25 है तो आपको 90 मिलीग्राम देना है, 23 से 40 है तो आपको 120 मिलीग्राम देना है, और अगर 40 के ऊपर है तो यू हैव टू गो फॉर अ फुल एडल्ट डोज, दैट इज 150 मिलीग्राम. सो दैट इज हाउ यू हैव टू डिस्ट्रीब्यूट इट. तो जहाँ पर आपको ओरल देना है, आपको कैप्सूल में दे सकते हैं, आपको बच्चे हैं, पीडियाट्रिक है, आप उसको सिरप में भी दे सकते हैं. सो दैट इज़ वेरी इंपॉर्टेंट. एंड द मोस्ट इंपॉर्टेंट पार्ट इज़ दैट कि आपको प्रोफाइलैक्सिस जो है वो आपको वंस अ डे देना है, और ट्रीटमेंट पार्ट है जो थेरापेटिक जो है वो आपको ट्वाइस अ डे देना. तो दैट इज़ वेरी इंपॉर्टेंट. सो ट्रीटमेंट विद ओसेल्टामिविर शुड बी इनिशिएटेड विद इन 48 आवर्स ऑफ सिम्टम्स. दैट इज़ द क्रक्स. आई थिंक सबसे इंपॉर्टेंट मैसेज आपको आज इस लेक्चर से यही जाना चाहिए कि यू हैव टू स्टार्ट इट वेरी फास्ट. You have to start your treatment with oseltamivir within 48 hours of diagnosing or having a symptoms. You cannot wait too long to complications to get happen. So अगर आपको लग रहा है, थोड़ा भी आपको डाउट है कि इस बंदे को फ्लू हो सकता है या इसके अंदर में वो सारे सिम्टम्स दिख रहे हैं, तो आप वेट ना करें, तुरंत ट्रीटमेंट शुरू करें. बिकॉज 3-4 दिन के बाद में जब आप सोचोगे मुझे ड्रग देना है, पॉसिबली मोस्ट ऑफ द टाइम you will be too late, or sometime what happens, the disease itself will subside. So what happens is that you have to give it very fast to prevent the complications and to have the good effect of the drug. So that is most important. Next slide. So Oseltamivir 30 milligram capsule, it is there. Next. So again I've told you, less than 15 किलो है तो 30 मिलीग्राम है, 15 से 23 किलो है तो 60 मिलीग्राम है, 23 से ऊपर है तो आपका 90 मिलीग्राम है, 120 मिलीग्राम है और फिर 150 मिलीग्राम है. बट प्रोफाइलैक्सिस इज बेसिकली फॉर 30 milligram once a daily, and possibly therapeutic is 30 milligram twice a daily. Next slide. So 30 milligram capsule is there. Benefit of empirical and early use of Oseltamivir. A lot of trial been there. I'll go just little fast for this trial, but very simple. Now a 50-year-old man, farmer by occupation from India with no underlying comorbid conditions, was referred to a tertiary care center in Srinagar. So there was a case from Srinagar. The patient has got low-grade fever, sore throat, myalgia for 7 days. सिंपल है ना, वेरी रूटीन केस. आप सब लोग ये केसेस देखते हैं मोस्ट ऑफ द टाइम. ऐसा बंदा आता है कि डॉक्टर साहब 5-7 दिन से सर्दी खांसी बुखार जैसा लग रहा है, एंड दिस इज. उसको जब पूछा गया कि इन हिस्ट्री ऑफ चेस्ट पेन, ब्रेथलेसनेस, ऑर्थोपीनिया, वॉमिटिंग, डायरिया, ही सेड नो. बिफोर रेफरल ही हैज रिसीव्ड एंटीबायोटिक्स इन द फॉर्म ऑफ सेफ्ट्राइक्सोन एंड लिवोफ्लॉक्सासिन विदाउट एनी इंप्रूवमेंट. सो उसको एंटीबायोटिक दी गई है, एक टिपिकल के लिए और एक एटिपिकल के लिए, लेकिन उसमें कोई इंप्रूवमेंट नहीं था. नाउ ऑन एग्जामिनेशन द फीवर वॉज 100, the pulse was 110, obviously tachycardia was there, and BP was little hypotensive, 110/72. Chest examination revealed bronchial breathing associated with bilateral coarse crackle. So again typically pneumonia was settling in clinically. His CK and CPK were very high, LDH was very high. Now mid-zone interstitial infiltrate on chest radiograph, nasopharyngeal swab was taken, and PCR of which positive was H1N1. So this was the previous cases, though that time H1N1 was prevalent. But you can see this, what is happening. Obviously the CRP was not very high, but cardiovascular, abdominal, other systems were also normal. All other things were normal except there was some pneumonia, and there was a hypotension, and there was a crackles. Next slide. And there was a high grade fever. So you can see this X-ray. I don't know whether you can appreciate or not, but you can see the bilateral mid-zone infiltrates which are very much there in this X-ray, and you can make it out that there is something happening in the lungs, typically in the middle or possibly the lower lobe. Next slide. So on treatment, so the moment they presented this case to Srinagar, because he was already 5 to 7 days old and he was taking some treatment, was not getting better, they put him on Oseltamivir 75 milligram twice a day for 5 days, and obviously all symptomatic treatment was going on. The patient showed a marked improvement in his symptoms with progressive decrease in CPK, LDH, and the radiograph was cleaning. You can appreciate that the shadows which were there, the infiltrate which were there in previous X-ray has been actually cleared up. So 5 days simple treatment of Oseltamivir has done wonders to this patient. कितना इजी तरीका था इस चीज़ को ट्रीट करने का, और 5 दिन के अंदर में आपने देखा कि एक्सरे कितना अच्छा हो गया, एंड ऑल द अदर मार्कर्स ऑफ इन्फ्लेमेशन आर आल्सो गॉन डाउन. सो दैट इज हाउ द ब्यूटी ऑफ दिस ट्रीटमेंट इज. नेक्स्ट स्लाइड. So Oseltamivir treatment of influenza-like illness reduces, not only the total cost but also the antibiotic use and also the hospitalization. That is very important. So खाली Oseltamivir देने का मतलब ये नहीं है कि हम आपका पेशेंट को कुछ अलग ट्रीटमेंट, पर इसके वजह से आप जो बेवजह जो आप एंटीबायोटिक भी यूज़ करते हो उसका यूजेस भी कम होगा, हॉस्पिटल कॉस्ट भी कम होगा, कॉम्प्लिकेशंस भी कम होंगे, पेशेंट विल गो बैक टू द वर्क वेरी फास्ट, वेरी अर्ली, सो ही कैन सेव लॉट ऑफ मनी ऑल्सो एंड ही कैन अर्न मनी ऑल्सो. सो दैट इज वेरी इंपॉर्टेंट. सो एंटीबायोटिक यूज हैज़ गॉन डाउन बाय 26%, the clearance was there, and obviously the hospital bill was decreased by 60%. So एक आप सोचिए, एक सिंपल फ्लू लाइक इलनेस के लिए अगर कोई बंदा एडमिट होकर 2 लाख रुपए का बिल भरता है, एंड इफ यू गिव द ट्रीटमेंट इन अर्ली बाय जस्ट गिविंग Oseltamivir and probably other drug, you can save so much of money. So that is where your clinical knowledge and your aggressiveness will come into picture. तो बताने का उद्देश्य यही है कि आप खाली एंटीबायोटिक्स या खाली वो चीज़, आप, मैं ये नहीं बोल रहा कि आप वो नहीं दे, बट आपको हमेशा वायरल इलनेस में आपको एंटीवायरल भी याद आना चाहिए. देयर इज समथिंग विच इज़ अवेलेबल, विच इज़ वेरी कॉस्ट इफेक्टिव, वेरी इजीली अवेलेबल, एंड इट कैन सेव द लाइफ, इट कैन सेव मनी, इट कैन सेव लॉट ऑफ अदर कॉम्प्लिकेशंस ऑल्सो. तो दैट इज़ वेरी इंपॉर्टेंट. नेक्स्ट स्लाइड. So obviously H1N1, if you early administer all this drug like Oseltamivir in any flu illness, not in H1N1, even in H3N2, which is currently going on, what you will do is basically that you will decrease the hospital admission and you will decrease the mortality because of this drug. Next slide. So that is very important. So the message is very loud and clear that you have to use it very fast, very aggressively, very early in the illness. So both the probability of pneumonia and probability of the symptoms because of that will go down if you use oseltamivir very early. And obviously when administer within 48 hours, 2 दिन के अंदर में symptoms के 2 दिन अंदर में अगर हम इसको use करते हैं, so it has got a considerable potential of reducing pneumonia, which will cause the further complications. So we have to use it before it goes inside lower respiratory tract and get organized as pneumonia. You have to hit the H3N2 or H1N1 with the oseltamivir right when the virus is in the upper respiratory infection. That is very important. Next slide. Again, shorter course of duration means patient where कम दिनों के लिए पेशेंट भर्ती दे अगर आपने ओसेल्टामिविर शुरू किया तो, सिंपल बात बोलने की है. अगर आप ओसेल्टामिविर शुरू नहीं करते थे तो एंटीबायोटिक पे पॉसिबली 2-4 दिन और ज़्यादा जाना पड़ता था इस पेशेंट को, बिकॉज वो वायरल इन नेचर था. सो एंटीबायोटिक वाज नॉट वर्किंग. सो यू हैव टू यूज सम टाइम एंटीवायरल वेरी जुडिशियसली इन दिस काइंड ऑफ पेशेंट. नेक्स्ट स्लाइड. So oseltamivir azithromycin combination therapy reduces secondary bacterial infection. That was again the data, but the whole idea is that we have to understood that one has to. I'm not saying you should not give antibiotics to this patient. Yes, we have to give sometimes, and most of us will give antibiotic. But don't forget about antiviral, which are very important, weapon in your armamentarium. Because और कोविड के बाद में हमने सीखा है कि जब हमने कोविड में कोई भी प्रकार के एंटीवायरल यूज़ किए थे जो हमारे पास कभी थे भी नहीं, राइट फ्रॉम रेमडेसिविर, फाइविपिराविर, मोलनुपिराविर, व्हाटएवर, वी हैव यूज एवरीथिंग एंड वी आर सो कॉन्फिडेंट. कितने पेशेंट्स को इतना सारा टॉक्सिसिटी था उसके बावजूद भी कुछ नहीं हुआ. सो दे आर वेरी सेफ. द प्रॉब्लम इज दैट आवर माइंड डजंट रिकग्नाइज द एंटीवायरल. वो एंटीबायोटिक रिकग्नाइज करेगा, वो एंटी फंगल रिकग्नाइज करेगा, वो बाकी चीज़ रिकग्नाइज करेगा, लेकिन एंटीवायरल के लिए थोड़ा दिमाग बंद हो जाता है. पॉसिबली बिकॉज वी डोंट कंसिडर इट वेरी पोटेंट, और समटाइम्स हम भूल जाते हैं कि एंटीवायरल नाम की भी कोई चीज़ है. बट आपको याद रखना है कि इन सच केसेस एंटीवायरल्स आर द ड्रग ऑफ चॉइस व्हेन यू आर डीलिंग विद सच काइंड ऑफ इलनेस. नेक्स्ट स्लाइड. सॉरी. So same thing, oseltamivir, next one. Oseltamivir or azithromycin combination was given in H1N1 patient, and obviously antibiotic was given to prevent the secondary bacterial infection. एक ख्याल में रखिए, एंटीबायोटिक हम इसलिए देते हैं कि भाई अगर ट्रीटमेंट के दौरान अगर कोई सेकेंडरी बैक्टीरियल इन्फेक्शन होता है या पेशेंट को अगर आप एडमिट करते हो एंड देन यू डोंट वांट टू गेट एन हॉस्पिटल एक्वायर्ड निमोनिया और नोजोकोमियल, अगर आप पेशेंट कम्युनिटी में से, तो देन यू गिव एंटीबायोटिक एज अ सेकेंडरी मेजर. बट जस्ट डोंट गिव एंटीबायोटिक इन सच पेशेंट्स व्हेन यू आर कंसिडरिंग फ्लू एज अ हाई प्रोबेबिलिटी. प्लीज गिव एंटीवायरल, दैट आर मोस्ट इंपॉर्टेंट. एक बार का आपने वो टाइम पे एंटीबायोटिक नहीं दिया तो चलेगा, बट एंटीवायरल मिस मत करिए, स्पेशली विद इन 48 आवर्स, बिकॉज दैट इज मोस्ट इंपॉर्टेंट. नेक्स्ट स्लाइड. सो व्हाट द गाइडलाइंस इज. इतना सब डेटा बोलने के बाद में, इतनी सब बातचीत करने के बाद में गाइडलाइंस क्या बोलती है, लेट्स सी दैट. सो नेक्स्ट स्लाइड प्लीज. आई थिंक स्लाइड थोड़ा सा स्टकअप हुआ है.
Just a minute.
या नो प्रॉब्लम. Yeah, so even guidelines also say the same thing, that all these bodies across the world, even WHO and everything, they all monitor or they all recommended to use antiviral like oseltamivir upfrontly. आप 4-5 दिन बाद में देने के बाद में आपको कोई सेंस ज़्यादा नहीं बनता है. वॉट यू इफ़ यू वांट टू गिव इट अर्ली, दैट इज़ द मंत्रा, दैट इज़ द मंत्रा फॉर सक्सेस. इफ़ यू वांट टू सक्सेड इन अ वायरल इन्फेक्शन, एनी वायरल इन्फेक्शन, यू हैव टू गिव इट वेरी फास्ट, वेरी अर्ली, वेरी अपफ्रंटली. सो empirical therapy including a neuraminidase inhibitor like oseltamivir for treatment of influenza where the local circulation or other risk factors or there is a history of travel is there, you have to give it. That is very important. So that is where you need to understand that you have to give it very fast, and empirically भी आपको देना है तो day 1 पे ही देना है आपको, because you can't wait for too long, because after some time it might get secondary infected. So that is very important. Next slide. Yeah. Next slide, Manor, is
Yeah, it's changed.
I think there are 2-3 more slide, I think, and then we
Just
can.
a minute.
This is loud.
Yeah.
Now it is visible? Yeah.
Yeah. So we recommend that anti-influenza treatment such as Oseltamivir can be prescribed for adult with CAP who test positive for influenza. That is a proven case. But yes, you can use as empirical as a prophylaxis also in the cases where you are highly suspicious of influenza, typically in the season what we are right now. And why we want to prescribe? Because it can prevent risk of death in patients who are hospitalized or who are very severe enough for that kind of illness. And obviously, treatment within 2 days of symptoms within the onset of hospitalization may result in best outcome. So that is where the trick is. You have to give it early, you have to give it proper dosing, you have to give it for 5 to 7 days, and you have to just see whether your patient is getting better on day 3 or day 4 with antiviral. That is very important. Otherwise, you need to increase dose sometime or you need to change sometimes. So that is very important. Next slide. So to summarize my whole talk and to just give you the gist of my talk, proper diagnosis can and early treatment can prevent flu complications. And there is nothing like, there is no Ramband or there is no mantra ki who is the person who is going to get complications because of flu. It's like a lottery. It can happen to anyone. So even a very sick patient with flu or a very old patient with flu can survive without any treatment, and sometimes even a very young patient, a healthy patient with flu can succumb to a simple illness like flu. So that's why you have to keep your the suspicion very high, and you have to be very preemptive and very proactive regarding the treatment. Empirical use of Oseltamivir reduces lower respiratory complication, hospitalization, and antibiotic uses. I have told you in that data also how early use of FLUVI or Oseltamivir can actually reduce the complications, and in that context it can reduce the hospital stay and cost also. And all the various society across the world, whether it is ATS or whether it is American or European or WHO, they all recommended empirical use of Oseltamivir and obviously therapeutic use of Oseltamivir. Next slide. So in and all, we have to use this drug in a best possible interest of our patient. We have to use it very early. We have to give proper dosing of Oseltamivir. And last but not the least, we have to give benefit of doubt to the patient, not to us, by just giving the drug. We have to give them drug so that it works in whatever sense it can work. Because after 4 or 5 days, once patient lands in hospital in ICU, possibly this drug will not work that much that what it works in early phases of the illness. So that is what is my message. You have to be very proactive. Use drug which is available, which is a proven drug for last 15 to 20 years. It has a good data and it is very easily available, very affordable and very simple dosing. जैसे favipiravir, molnupiravir का डोज वॉज वेरी erratic and too many pills, people were confused, not available. इसका बहुत simple है, 75 milligram twice a day for 5 days and you are done. And in prophylaxis you can give once a day for 5 to 10 days and you are done. So that is where it is. So all in all, it's a very good drug to use. You have to use it judiciously, but you have to use when there is a high index of suspicion and when there is a local epidemic which is going on, which is currently going on in India, and we can benefit a lot of our patient by giving this drug. So I'll stop here and I thank you everyone for the patient listening, and then possibly we'll take questions. Possibly Dr. Ankit has to have few comments on this and then we can go ahead.
Dr. Akhi, you wonderfully explained the topic, but I would like to summarize again for this for our listeners. Overall, what I got from this presentation, first thing you have to look for the challenges. First challenges I got is the changing nature of the disease, or you can say changing nature of the infection. Previously, we thought that this disease is a seasonal disease. It start from the early in the monsoon and till the later at the end of the monsoon. It means that July, August to, and the second peak is in January and February. If we see the ICMR data, the nature of the disease is changing. This disease is going towards the perennial disease. So you have to, for our listener, you have to think that it can present in any month of the year, right? Second thing is that the incidence and death, incidence and mortality both are increasing year by year, right? So if you use antiviral early, you can prevent deaths, right? One more thing you should remember about the red flag signs, when to start antiviral in your patient. I think that is the left in our presentation. Any patient who have the severe respiratory distress, any patient who have CNS symptoms, any patient who's have persistent abdominal pain and vomiting with respiratory symptoms, right? Patient have dizziness, these are the category of the patient who is having the symptoms of the flu and this symptom you should consider for the oseltamivir. Right, Dr. Rathi? I think.
Well said. I think that is very important. Plus, very important message just to the patient who have been, infected with COVID or who have been, admitted for COVID, severe COVID. Now they come with, a very, this kind of illness in that patient because there is already respiratory compromise in this patient because of COVID. So they are more vulnerable for getting this flu infections again and again. So that is another very important point. Yes, sir.
Manohar, I think we should take questions.
Yeah. Questions I have posted, sir. I'll just request you. So one by one, sir, what will request Dr. Ankit? You can answer these questions one by one.
Okay.
Yeah.
First question is what precaution to be taken in elderly patient while advising the oseltamivir? I think this is a very safe drug, and if patient have mild moderate hepatic failure or renal failure, you can easily prescribe oseltamivir. I think you should not worry about this drug. Yeah.
Okay, the second question is what about gastric irritation with oseltamivir? Absolutely no, there is nothing, no gastric irritation with oseltamivir. It is as good as any other drug. So there will be some patients who might get some gastritis or some sensitivity. Otherwise, it's a very safe drug, so don't worry. And possibly it is very least. Basically there is no cross reaction with any other drug, so that is the best part. So it can be given safely with other drugs. You don't have to worry about cardiac or other side effects which are there with a lot of drug. So as far as gastric irritation is there, be very assured that has got hardly any gastric irritation.
And one more thing, this drug is not have any interaction with food, so you can take this drug also with food.
Yeah. So what are the side effects to be keep in mind while prescribing oseltamivir? So possibly there are no side effects, and the good part is that you have to just give it for 5 to 7 days. So don't worry about too much. It is not a chronic drug which you have to give it for 10 days or 20 days or 30 days. So possibly 5 to 7 days, and there are hardly any side effects except for I have told you there will be some nausea, vomiting in some patients. Otherwise, it's a and the good part is that it's a pro drug. So there is no active form which is you are giving from outside. So it get converted into your liver into a carboxylate. So that is very important. So as far as side effect is concerned, there are hardly any side effect. But if it are there, so possibly that can be managed very well with your other co-prescription. So no major side effect. That is the answer to this question.
Next question is, can we prescribe antibiotic with FLUVI, and if then how long? I don't think this antiviral have impact on any changes in the management of the community acquired or hospital acquired pneumonia. You should treat according to your protocol, right? This drug is an add-on drug. When you are suspecting this viral disease, you can add this. So your basic protocol for the treatment of it is not.
Yeah, so that was very rightly put by Ankit. Antibiotic will be there. Come on, you cannot go away without antibiotic. Everyone will write antibiotic by hook or crook.
Same thing I am saying. Protocol is not changing. As you previously treating community container, you are still going to treat your community container. It is add-on therapy.
Yes. I really agree with Dr. Ankit. And even nobody will dare not to write antibiotic because people are so obsessed, and you are right in your own sense also, because antibiotics are something which are like bread and butter, and so you have to write it unless and until there is absolutely proven cases. But yes, this is an add-on drug, so but don't miss antiviral. That is the whole message. If you are writing antibiotic, okay, fine, but at least if there is a high index of suspicion and there are proven cases, local epidemic, don't forget to write antiviral. That is very important. Now, difference between H3N2 and H1N1, I have told you in that slide also. Now, viral illnesses will be more or less same. अगर आप मुझे पूछेंगे कोविड में और H3N2 में क्या डिफरेंस है, तो almost same है. It is just a diagnosis which is there. But yes, H3N2 में how to see it clinically, there are certain signs like I've told you, a very high grade fever, a very severe headache, body ache, and possibly loss of energy or lethargy. These are very common with viral illnesses, that too typically with flu viruses. So that is where they are. And if you see COVID now, अभी का जो कोविड चल रहा है XBB 0.16, which is very low, which is very low mild illness, and not very high grade fever, possibly low, but flu or H3N2 will have severe body ache, headache, high grade fever, lot of muscle pain, and low back ache. These are very common with flu, so that you need to understand. These are the subtle differences between the H3N1, H3N2 and H1N1. So that is very there, but again, everything can come with everything, so you have to be very clinically oriented. But on a OPD basis, just to have a superficial diagnosis, these are certain points where you can at least think of H3N2 more as compared to COVID or H1N1.
If you
There is
are
a last
asking from treatment point of view, there is no difference in treatment in between S3N2 and H1N1, right? The treatment protocol and treatment is almost is same for both these things.
या सो अगेन एंड टू बी वेरी ऑनेस्ट, अभी तक वैक्सीन के अंदर में जो हम क्वाड्रीवैलेंट जो वैक्सीन देते हैं उसके अंदर में H3N2 का स्ट्रेन नहीं है, बिकॉज दिस इज द करंट स्ट्रेन. दिस विल कम इन द नेक्स्ट वैक्सीन विच इज गोइंग टू कम इन नेक्स्ट ईयर. सो अभी आपके पास में H3N2 का कोई वैक्सीन नहीं है. दिस विल कम इन नेक्स्ट ईयर वैक्सीन. सो अभी हमारे पास में H1N1 का वैक्सीन है, H5N1 का वैक्सीन है, जो क्वाड्री जो होता है उसके अंदर में वो 3-4 है, तो ये नहीं है. बट गुड पार्ट इज दैट कि ऑल दिस neuraminidase inhibitor like Oseltamivir or Zanamivir, they will act on all kind of influenza A virus के जितने भी सब variety उसमें सब में काम करेंगे. So that is very important. So to answer your question, it doesn't make any difference whether you are vaccinated or non-vaccinated. Possibly you will not get very severe disease in a vaccinated patient, and you might get a little milder disease, so that can happen. But with H3N2 being a newer variant, possibly you have to treat them as a treatment naive patient, so that is very important. So vaccination will make not much of difference, so that is very important.
Yeah, I think that completes the entire questions which is being asked by the attendees. So to both the speakers, I would like to thank you so much for being on this panel and sharing your thought with us. And definitely, I'm confident that the audience must have been delighted with your experience which you have shared. And along with that, I'm sure that it will be very much useful to our audience also. So at the end, I thank all the attendees to joining this webinar and sticking till the time. So thanks to everyone, and thank you, Dr. Katiyar and Dr. Ankit Kumar, for sharing your valuable experience on this platform. Thank you, sir.
Thank you, Manoj.
Thank you.
Good day. Bye bye.
Thank you, Uncle. Thank you, sir. Yeah.